The following portion of Daytime is sponsored by Orthopaedic Medical Group of Tampa Bay.
Your thumbs play an important role in everyday tasks like buttoning your clothes or writing with a pen. But as the joint in your thumb becomes worn out, it can lead to painful thumb arthritis. And here to tell us how we can manage this condition is Dr. Thao Nguyen with Orthopaedic Medical Group of Tampa Bay. Dr. Nguyen, thank you so much for being here with us today.
Thank you for having me.
So give me a brief overview of thumb arthritis. What are some of the causes and the symptoms of it?
So the causes is just doing everyday tasks, things like using your thumb to open jars, open cans, just simple things like even squeezing a tube of toothpaste can cause stress to your thumb, and then over time leading to thumb arthritis.
Okay, and you know the whole anatomy of this all. So what are some of the things that you tell people when they come into the office?
So actually my patients come in complaining of thumb pain. So they tell me what their symptoms are and they say, "Doc, my pain hurts right here." And they come in and they point and they hold their thumb in this position. They say, "This is where it hurts." And that's typically where the thumb arthritis, that's where the thumb arthritis is. And so patients complain of pain when they're doing those activities. Even like holding your phone for a prolonged period of time can also lead to thumb pain.
Okay, and so show me on the x-ray here, what are we seeing?
Okay, so this is the thumb right here, and this is the joint in which becomes arthritic, and this is a normal x-ray when there's no arthritis of this joint, and you can see on this side where there's significant joint arthritis of this area.
So that kind of highlighted area, that's
exactly.
where it is.
Yep.
So what are some of the more conservative options for treating this?
So I talk to my patients about first things as activity modification, so not opening bottles, buying a bottle opener, or doing things like not holding your phone for a prolonged period of time to help not carrying your groceries with your thumbs or your hands, holding it with your biceps rather than taking the stress away from the joint itself.
What are the indications that maybe a surgery is needed for thumb arthritis?
So the indications is having to fail all the conservative treatments. So first is activity modification. Second is anti-inflammatory medications, either a cream or a pill. And then the third, then we also talk about bracing. You know, patients can wear a brace when they do the activities that make their thumb painful. And then third step is cortisone injections to help when their thumb becomes very significant, that causes their pain every day.
Okay, and you know what's interesting is that when you think of arthritis, you may think of someone a little later on in their life, but with as much as people always have a phone in their hand and young people are always texting or they're on social media, do you find that there's a lot of young people that have this now?
Yeah, I have patients now in their early 40s coming into me saying, I have this pain doing certain tasks, not everyday pain, but specific tasks like opening doors, and their x-rays are normal, but they have the symptoms of very early thumb arthritis. And I say very early because there's no radiographic findings of arthritis, but they have the symptoms of thumb arthritis.
And so that's when you say just start with the modification.
Exactly.
Okay, Dr. Nguyen, thank you so much for being here with us today.
Thank you so much for having me.
And if you want more information on Orthopaedic Medical Group of Tampa Bay, you can visit omgtb.com. Daytime will be right back.
The preceding portion of Daytime was sponsored by Orthopaedic Medical Group of Tampa Bay.